Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, December 8th, and as always, this is your chance to get your COVID questions answered. You can put your questions directly into the box below. You can also put a hashtag on either Facebook or Twitter, hashtag AskDrArwady, and we will be taking your questions live. It's an exciting day because just about an hour or two ago, the FDA has posted on its website the preliminary information related to the emergency use authorization for the Pfizer-BioNTech vaccine that they will be considering formally on Thursday. So this Thursday, December 10th, is when the FDA will be meeting to look at all of the data that was submitted related to the safety and efficacy of this vaccine. But they've posted some of that data in advance of the meeting. So we just started looking at it before coming over here to do Facebook, and it looks good. It looks in line with what we've expected in the media reports. We'll be diving into it in quite a bit more detail, posting some summaries of it on our website. As always, you go to chicago.gov/coronavirus. It's where you get all information about COVID here in Chicago. Right up at the top, as always, is the latest data tab, but we also have a tab there now for vaccine, and we'll be updating that. We already have started putting a lot of information there, and much more will be coming. You can also get there directly by going to chicago.gov/COVIDVax. So I know you're going to have a lot of questions, and we've already been getting a lot of things in. So let's go ahead and turn straight to the data. You can get there, as I said, off the website. You can also get there directly at chi.gov/COVID-. And if we pull up the website, so first of all, right up at the top, our current positivity rate for the city, the 7-day rolling average, you can see is at 13.4%. And if you look at this graph to the right, you can see that it had dipped down and is coming up just a little bit now. A week ago, it was 11.4%. In the second wave, we had peaked at about 15.9, 16%, had seen it come down, and now, unfortunately, coming up again just a little bit. Some of that is because we're seeing a pretty significant drop-off in testing. You can see we've done now more than 2 million tests just in Chicago residents for COVID, but our daily test average is at about 12,270 per day as the rolling average. And if you look at the graph here, you can see that it's fallen off really significantly. Most of that is because actually of the Thanksgiving break still. Remember, there's some delay in terms of when the cases are getting reported to us. And this bottom graph here shows you the daily tests performed. I'm going to zoom in a minute just so you can see what I'm talking about. If we just look in, actually, let's do it this way. I'll blow this up so you can see it. So if you look at daily tests performed, normally Monday, Tuesday, Wednesday, Thursday, Friday, we always see a big drop off on Saturday and Sunday. We record tests by the date that they are done, as opposed to the date that they are reported back on. Because if there's reporting delays in terms of how COVID is actually spreading, what the impact of it is in Chicago, more important is to know when people were actually diagnosed. So our typical pattern is 1, 2, 3, 4, 5 higher days, and then lower testing on the Saturday and the Sunday. 1, 2, 3, 4, 5, lower on the Saturday, Sunday. This is why we do a 7-day average to account for this regular drop in the weekends. But then this is the week of Thanksgiving. Monday, Tuesday, Wednesday, and then see this way, on Thursday, we only had about 2,800 people get tested for COVID in Chicago. Those would probably only really be people coming to an emergency room or maybe an urgent care. And then even Friday was much lower than a normal Friday would be. And then Saturday and Sunday, a little lower than a typical weekend. But what's interesting is that in the week that's followed that, you can see here's Monday, Tuesday, Wednesday, Thursday, Friday. Those numbers have actually remained quite a bit lower than in the weeks leading up to this. So we think that's a mix of some improvement in terms of COVID exposures, as our numbers are certainly a little better than they were. But some of this is also, we think that a lot of people were probably getting tested leading up to Thanksgiving. If they were going to be traveling or gathering, that was probably a piece of this, although certainly the recommendation was not to. And we're watching pretty closely to see how well these testing numbers recover. So as we go back to the report here, that means that our daily case average is at 1,412 per day. That is also coming up a little bit. So our peak this second time around was up around 2,400, but as there's some delay in reporting again, and we've seen that already start to go up, and unfortunately, I expect that to go up some more. My guess is our rolling average tomorrow will probably be in the sort of 1,600, 1,700, maybe even getting up toward the 1,800 range, and this is that post-Thanksgiving bump, unfortunately. We'll know more really over the rest of this week, how that's going to balance out, but we are seeing some increases in numbers, some decreases in testing, some increases in positivity. The hope is that this won't replicate where we were previously, and then we'll be able to get back onto that good downward trajectory. If we look just quickly over here at deaths, you see we are averaging 17 per day, which is a lot, given that we were averaging 2 to 3 per day over the summer. And that has not yet really showed signs of decreasing. So you can see even on the city case rate here, where we zoom in a little bit, this was coming down and then has sort of plateaued, is starting to come back up. I do expect that to come back up a little bit more, and then hopefully we'll get on more of a downward trajectory, but we'll see. So I encourage you to explore that some more, but let's go ahead and get to your questions. Actually, the first one here is A.W. Sanders on Twitter. Why has testing fallen by a third from a peak in November? Again, we think some of that is the rolling average from Thanksgiving, and some of it is probably just fewer exposures. As a reminder, first and foremost, we want anybody who has any symptoms that could be compatible with COVID to absolutely get tested and isolate while you're waiting for that test result to come back, but also anybody who's had that known exposure. You want to wait at least the 5 to 9 days after the exposure and then can get tested. You need to do the quarantine even while you're getting tested, and there's been some changes to that CDC guidance, as you know, but we are probably seeing a little bit less COVID circulating, but we are already seeing some bump post-Thanksgiving, so more to come. Okay, Susan Villanosa on Facebook, and here's lots of vaccine questions starting to come in. Do the VA hospitals already have a supply of the vaccine, and what about universities? Okay, so let's do some baseline setting here, again, related to vaccine planning. First and foremost, before any vaccine can be administered in the US, 2 things have to happen. First, the FDA has to grant the emergency use authorization for a vaccine. They are meeting on Thursday to consider the first vaccine, the Pfizer vaccine. That's the data that just got posted on the FDA website this morning. And they may, all signs look positive that they will likely grant that emergency use authorization. I don't know whether that will be, the committee makes the recommendation and then the FDA typically follows the recommendation. It may be on Thursday, it may be on Friday, we don't exactly know. It could even be a little bit later, but we're anticipating likely, based on the data that's been shared, that the FDA will grant that emergency use authorization sometime probably in the next few days, really by the end of this week potentially or early next week. After the FDA grants the emergency use authorization, we still cannot start giving vaccine. The other thing that needs to happen is the CDC needs to make the actual recommendation for who should receive this vaccine and give guidance about how it should be given. So the committee called the ACIP, the Advisory Committee on Immunization Practices. Again, this is a non-governmental group of experts, just like the FDA has its non-governmental group of experts to advise. The ACIP will be meeting, and they've said they'll be meeting just sort of 24 to 48 hours after the FDA grants the emergency use authorization. They may then take, after meeting, another 24 to 48 hours to actually issue the guideline, the recommendation to start vaccinating. So both of those things have to happen, and we can't know that timeline for sure. If the FDA approves on, say, Thursday or Friday or into Saturday, then the CDC and the ACIP will likely meet maybe this weekend, possibly into Monday. Maybe we would be getting that ACIP and CDC recommendation possibly as soon as early next week, but this could get pushed back. Only after that has been given can U.S. providers that have vaccine available be able to vaccinate. The Chicago Department of Public Health, anybody who's going to be vaccinating has to sign an agreement that if you want to receive this vaccine free of charge, which we do, it's the only way to get vaccine right now, is through the government, that you agree to follow the ACIP recommendations. And so this is where the ACIP has recommended that the first doses go to healthcare workers and to people who live in and work at long-term care facilities. But there will be more specific guidance that they give about age limits and time frames, et cetera. So if all of that comes through, after that point, people can begin vaccinating. Now, here in Chicago, we will be able to put in the formal request for hospitals, for example, to start directly receiving vaccine if they have that cold storage after the ACIP gives that approval. So if that happens on Monday, we'll be putting in that request, and then there are plans to really ship, again, within 24 to 36 to 48 hours, but it's going to be probably over the next week or so that vaccine is being shipped. And my anticipation is that we will likely start vaccinating here in Chicago later next week versus possibly the following week. This is all dependent on a number of processes that we don't have control over. The Chicago Department of Public Health will have received some what's called pre-positioned vaccines. So we will have some smaller amounts of vaccine available. But our plan here is to really start with vaccinating across all Chicago hospitals at really approximately the same time within that first week or so that vaccination is happening. So hospitals that have that ultra cold storage capacity, because the Pfizer is the ultra cold storage, will receive some of that vaccine doses directly to the hospital, and CDPH will be distributing to all of the hospitals that do not have ultra cold storage in the same time frame. So we'll start at all hospitals. There's 34 hospitals in Chicago, including the 26 acute care hospitals and then 8 specialty hospitals. We're not including, there's 3 that do behavioral health. They're not in the first group, but our 34 hospitals will be starting really all at the same time, likely late next week, going into probably the following week. So the VA, because it is it's a federal institution, will likely be receiving federal allocations of vaccine. The exact timing, of course, all of this is dependent on a lot of logistics. Even if they start to receive pre-positioned vaccine, just as CDPH may receive pre-positioned vaccine, we cannot give it until anywhere until both the FDA and the CDC have signed off. So all of this, I do expect, it's really exciting, will be starting probably in the next week or two, all over the country, including here in Chicago. All right, Joy Williamson on Facebook. The state has identified which hospitals would have vaccines, but not for Chicago. Which Chicago area hospitals will the vaccines be available? So all Chicago hospitals, like I just said, will be receiving vaccine for staff at the same time. Really, we're using that very first week of allotment that we're getting from the federal government. And just to clarify, Chicago, and the Chicago Department of Public Health does receive its own supply of vaccine separate from the supply that goes to the state through the Illinois Department of Public Health. And that's because a number of large cities around the country typically receive supplies and other things directly from CDC. And that's how vaccine channels normally work. The Chicago Department of Public Health handles what's called the Vaccines for Children program, where we ensure that hundreds of providers here in Chicago get free vaccine to be able to vaccinate children. We also do a lot of distribution of flu vaccine. And so there was a decision, I think a good decision at the federal level, to use the same distribution channels that we typically use for childhood vaccines, for flu vaccines, because we know how to do that. This is just going to be a much larger campaign, a different time frame, different logistics around cold chain. And we have So at the state level, they do need to cover the whole state, of course, with the allotment that they've gotten. And so they've done some prioritization of counties and, again, of hospitals that can handle that ultra cold. We have the responsibility for just the city of Chicago, and we are supporting at the same time big hospitals, small hospitals, safety net hospitals, specialty hospitals. Some of the smaller hospitals will probably receive a smaller number of doses at the beginning, but we've looked at how many employees hospitals had. And importantly, this ultra cold vaccine is really pretty complicated from a logistics standpoint. So you have to be very careful at the state level and at the city level to make sure that we are not pushing vaccine out to a location that is not ready to receive it. Because once you defrost, basically, this ultra cold vaccine, you only have 5 days to use it. You cannot put it back in the ultra cold freezer. And so it's important that if we're sending vaccine, to a hospital, that hospital needs to have, really specific plans. With only 23,000 doses the first week, no hospital is going to get anywhere near the amount of vaccine to be able to vaccinate all of its healthcare workers, but we will continue to grow as more vaccine becomes available. We are planning at this point in the second week to start with our long-term care facilities. So again, we're planning to distribute to all 128 long-term care facilities. That's being done in partnership with pharmacies. So pharmacies will be going in with strike teams, bringing vaccine to both the residents and the healthcare workers in the long-term care facilities. And it's going to be just a series of, as more vaccine is allocated to us, as perhaps other vaccine is approved by the FDA, the Moderna vaccine is going to be considered just 1 week later by Pfizer. That means perhaps a couple weeks later, that vaccine may start to be available. We will continue to distribute out. And then a little further down the line, we will start doing some vaccinating for healthcare workers who are not hospital-based. Do we know what effect, Glenna Marley on Facebook, do we know what effect the COVID vaccine will have on people with long-haul COVID-19? Okay, so this long-haul COVID-19 term is the term that we're using for people who are continuing to have, in some cases, pretty significant ongoing complaints and problems related to COVID, even after they seem to have recovered from the initial COVID infection. And so we are seeing people reporting more longer-term fatigue, longer-term problems with concentration. We're having some people reporting longer-term issues, even related to hearts, lungs, et cetera. There's a lot of studies that are going on to really follow people and understand what is different in people's immune systems, what is different in people's genetics, what is the risk of this. But it's one of the big reasons why I worry when people say, oh, I don't have anything to worry about. I'm young and healthy. I don't have to worry about COVID. We are seeing even younger people sometimes getting this long haul. But back to the question. People are definitely going to be recommended to get the COVID vaccine, regardless of whether they have had COVID-19. We expect that the vaccine will give, it's a much more predictable dose, right? The part of the idea of these studies is you understand what dose of vaccine you need to give, to have a safe but effective vaccine response. That's really different than in nature, where people are exposed to really different amounts of COVID, and then they have a really different, depending on their own immune system, a different immune response. I can't fully answer that question because I don't think there have been studies done in people who have had these long haul symptoms who have been COVID vaccinated. But definitely we will be recommending that people who have had COVID, even if they have potential long haul symptoms, get the vaccine. This vaccine cannot give you COVID. It does not contain live COVID virus. It does not contain dead COVID virus, inactivated COVID virus. We've talked a little bit in prior Facebooks about how the mRNA vaccine works, but it's basically just giving the recipe for your cells to create the spike protein on the virus and then to be able to build this immune response to it. We would not expect that giving this spike having exposure to the spike part of the virus would give you these same sorts of effects. And therefore, my prediction would be that a COVID vaccine would not have any impact on people with, quote, long haul symptoms, except protecting them from perhaps getting reinfected with COVID down the line. But as we learn more about this, of course, we may need to update some of those recommendations. And that's always true related to new vaccines and, of course, new diseases. Mike Simmons on Facebook, will all hospitals be vaccinating all of their employees at the same time? Any concern about employees and healthcare workers being sore or unable to work for a day or two? Both of those are really good questions. So no, all hospitals will not be able to vaccinate all of their employees at the same time because, again, we have a limited supply of vaccine. So even the biggest hospitals, the way the vaccine is distributed with the ultra cold, sort of one box of the COVID vaccine, for the Pfizer vaccine, has just under 1,000 doses, 975 doses. And so even the very largest hospitals in that first week would probably get 2 boxes, for example. So they would only have the capacity to vaccinate up to 2,000, even fewer than 2,000 people. That's a lot fewer people than work in our big hospitals. Some of the medium-sized hospitals might receive 1 box, and then the smaller hospitals won't even receive a whole box. They'll receive enough to start doing, a few hundred, et cetera. And again, we have to make sure that there are plans to not waste vaccine so that every bit of the vaccine can be given. And then we may not even have additional vaccine that second week because we need to start vaccinating in long-term cares. So it may be the 3rd week, the 4th week before we continue to add it. So we have asked, the hospitals are all creating their own detailed plans for what makes sense for them. Chicago Department of Public Health did distribute some guidance around that, recommending that the healthcare workers at highest risk for COVID exposure be prioritized. So that would be people working in emergency departments or on COVID floors or in the intensive care unit, not just the doctors and the nurses, but the respiratory therapists, potentially the people who work, in environmental services, cleaning, potentially in food, but in those sort of more exposed types of jobs within the hospital. But each hospital will make its own decision about what they see as the best way to successfully get vaccine to staff and to do that prioritization. We do anticipate to continue being able to distribute vaccine really as long as it is needed to get hospital staff vaccinated, but we'll be expanding out to other groups as we go. And to the question about concerns about employees or healthcare workers being sore or unable to work for a day or two, yeah, that's a good question. This is one of the reasons why having some of this detailed data out from the trial is really important. I will share with you on Thursday when we meet some of the details. Certainly, at the high level, we know that a good number of people who got the vaccine, most of them actually, more than 80%, did report some sore arms, some injection site reactions, and more than 60% of them reported some fatigue. That said, something like a third of the people who got the placebo, they didn't even get the vaccine, also reported some fatigue. And this is why we do it as a randomized control trial so that people don't know if you've gotten the vaccine or the placebo. So I want to really spend some time looking at this data. We'll be putting it together, putting it on the website, talking more about it. But I think hospitals are thinking a little bit about, might you want to be offering vaccine to people on the weekends or perhaps before a day off? Certainly, this vaccine will not be approved, and there have not been the serious side effects associated with this vaccine. It wouldn't get emergency use authorization with serious side effects, but it is something that people may want to be thinking about. Again, we are letting hospitals make those final decisions in terms of what makes the most sense for their staffing and their logistics, as long as they can confirm that they are able to use the amount of vaccine that we distribute. Al Halverson on Facebook, are assisted living facilities considered long-term care facilities? They are. So there are 128 facilities that meet the definition here in Chicago. It includes our skilled nursing facilities, of which there are 78. Those are our highest risk settings. Those are where people are really needing a lot of hands-on medical care, and it's where we've seen a lot of outbreaks. It's where we've seen cases in this second surge again. A lot of healthcare workers infected, a lot of staff infected. I'm really excited, I have to tell you, about starting to have vaccine available and hopefully with very good uptake in these settings, because the Chicago Department of Public Health, understandably, has been putting a lot of resources in. We've been working really closely with these facilities to try to make sure, we've been doing a lot of testing every week to really make sure we do everything we can to keep outbreaks from being out of control in those settings, but they're so high risk that they will be prioritized. So it includes both skilled nursing and assisted living facilities. It does not include senior living, which would be people who are living in sort of independent senior living. It is for the ones that, as federally determined, again, have this level of assisted living, and that has been federally determined, and there was outreach directly from the federal government to enroll the facilities that met, and CDPH did follow up for anybody who had not filled out their paperwork to ensure that every one of our facilities, had that opportunity right from the beginning. Okay. So Dan Smith on Facebook says, someone I know tested positive for COVID and was told they had a strain that shows mild symptoms. I thought the severity of symptoms depends on how your body reacts to the virus, not that there are different strains circulating. Please explain. So yes, Dan, you are correct. Probably this was someone trying to just explain that people can have different effects. Some people will have mild, some people will have more severe symptoms, but there are not significantly genetically different strains that are circulating or that have been defined like that, or that have been shown to have majorly different effects. So you're correct. There are some slight mutations, certainly within the vaccine, but nothing that we've seen, we think, that suggests any major difference in terms of outcome or even in terms of how likely it is the vaccine is to spread. There's still studies ongoing about that, but certainly if this is someone here in Chicago, that would not be my first explanation. Instead, you're right, it would be a combination of what was their dose of COVID they were exposed to. This is part of why we've learned that masks, although first and foremost, they're most important for helping keep your germs in and protecting others, we've also learned that wearing the masks serves some protective role for you as well. And in fact, there's a hypothesis that some of the reason we're seeing more mild illness could have to do with people having lower sort of doses and exposures to COVID with more mask wearing. But that's a theory. We don't know that for a fact. But how much you're exposed to, and then the big thing is what are your underlying conditions, your susceptibility, your age, and then your immune response. Okay. Tanya Hampton on Facebook. When given the vaccine, she says, I know the recipient is safe, but can they still be carriers? So good question. I think you're asking here that, the safety data does look excellent for this vaccine, which it does, but you're asking, even if they are protected from COVID, can they still be a carrier? So two pieces on that. Certainly, the safety data looks good. And first and foremost, the FDA will not approve a vaccine that does not have an excellent safety profile. We've talked about that. Along with safe comes how effective is it? And this is where the data has been surprisingly good on these vaccines, 95% effective. That still means that in these phase 3 trials, 5% of the people who got COVID did get the COVID vaccine. 95% of the people who got COVID got the placebo, the dummy COVID vaccine. So it was 95% protective, not 100%. There are still, there were still a few people who got COVID. The good news is it was also protective against getting severe COVID, hospitalized, et cetera. And we'll be getting some more data about that. But it's, there is no such thing as a vaccine that is 100% effective. This is, 95% is fantastic, like best we could have hoped for a vaccine. But I do want to just make sure safety and efficacy are a little bit different. The question of whether they can still be carriers is not completely answered at this point. I think this is where and the studies don't end, right? Even when the FDA grants the emergency use authorization, they will continue to follow folks for a number of years. And there are other studies that are still enrolling. So if there are people who are not in those priority groups, especially, we're not going to have vaccine widely available here in Chicago for a number of months. I strongly encourage you to think about, if you're interested, signing up or at least learning more about the ongoing vaccine trials. We've got other vaccine candidates coming down the line. Johnson & Johnson is thought to be a single-dose vaccine. We do need to finish some of those trials, and we'll be answering these kinds of questions. The assumption is that as someone is protected from COVID, they also would be much, much less likely to spread COVID. And perhaps only these people, the much smaller percentage who still could have a mild illness. But I can't with 100% certainty say that that's true because the trials are still ongoing. So this is part of why, especially early on, we will be recommending that people continue to wear the mask and do the social distancing, even kind of before we start to get widespread vaccine. And that's going to be complicated messaging, but some of it is that we'll still be learning this piece. I have absolutely no doubt that this vaccine is going to be how we, assuming we have good uptake and it continues to, the safety and efficacy continues to behave like it has in these trials so far, this is how we're going to get past COVID as a society. I'm feeling very good about that, but it's going to be a slower process, and we are still going to be learning some of the details of those kinds of questions. Okay, Simon Downs on Facebook, do we know of any side effects of the vaccine? Have they run any trials with patients who are HIV positive? So I'm going to table that a little bit for Thursday because, like I said, I want to really talk in some detail and show you the exact data from the trial about this. But we know broadly that the side effects included more sore arms, some more fatigue, some more headache, some more fever in a short-term way for people who got the true vaccine as opposed to the placebo. That is not people getting COVID. That is people's immune system learning how to respond to COVID without making people seriously ill. And so then when they're exposed to COVID in real life, they don't get those symptoms. But I'm going to put that on hold so that we can really show some of this in detail after I've had a chance to look through it. And we've got a scientific advisory committee that's looking at some of this. There will be a lot more chance to talk about side effects because I want to really answer that question as robustly as I possibly can. They've not run specific trials for patients who are HIV positive. I don't actually know whether being HIV positive was an exclusionary criteria. My guess is not. So I don't know for sure. Again, I haven't seen all this data yet, but there certainly have not been large-scale trials of people who are HIV positive. I think if someone is HIV positive, but generally their viral load is good and their immune system is in good shape on medications, I think the sense would be that this would probably be protective, but this is where, again, there's going to be more conversation. And this is partly why the ACIP, the CDC, weighs in on vaccines. So the FDA grants just high level, this is a good vaccine for emergency use. It is the CDC through the ACIP, like for every other vaccine, that actually makes the recommendations about vaccinating. So that's the group that eventually will be making vaccinations for children, for pregnant women, for older people, et cetera, and probably we'll get some more nuanced, maybe around people who have immunocompromised conditions like HIV. So I would say more will be coming on that, and I will keep in the back of my mind if we're seeing information about studies in that population. Okay. Susan Shambaugh on Facebook is asking, how long is it safe to wear or reuse the same KN95 mask? Days, a week, or longer? Okay, so if these are the KN95s, first of all, you do want to make sure it's not one that has the valve. It's not the dust, the one that people are using for dust, that lets your germs out, right? During normal times, we would see construction workers use these masks because it stopped dust from getting in, but it let them breathe out very easily. Obviously, in the time of COVID, we don't want them breathing out easily. And so You want to make sure the KN95 is not one of the ones that has the valve. I have not seen, I will look to see if there's been any updated guidance on this. Generally, these tend to have a little more shape to them. And, we do recommend that they can be reused. They're harder to wash, though. This is the thing. And so one of the reasons why we continue to really like the cloth masks is that they've been shown, as long as it's 2 layers and it's got that good fit, really to be very effective as well. And you can wash them and reuse them more. So I would say, what we say generally in the healthcare setting, if they're holding their shape, as someone who used N95s for tuberculosis and other, you don't have to get rid of them each time. But if they're starting to look soiled, they're starting to lose their shape, anything like that, you wouldn't want to really keep using it. And you know better about how well are you doing a good job of sanitizing your hands? Are you keeping it in a clean plastic bag? Once it starts to seem soiled, you really shouldn't keep using it. And I really do I use personally a cloth mask. I'm not using N95s, KN95s, any of that. The data that I've seen is very good, really outside of a healthcare setting, just to use those cloth masks. And then that means I can throw them in the washing machine. So literally I put every single time I do my laundry, I gather up all my masks and throw them in the washing machine. And that's, what I would recommend. So if you've got these, they're fine to use, but don't keep using them if they're dirty or it's been a while. Oh, we are already coming up on time. That was very fast. Let me see if we've maybe got one more. All right, Kathy Harper on Facebook, because most of these have been vaccine related. We've got, if someone you're with has had COVID and is no longer contagious, because they've finished their quarantine or finished their isolation, is it safe to be with them? Yes. So let's talk this through, because I get this question a whole lot. If someone has been diagnosed with COVID, they need to isolate for 10 days, and their symptoms need to have resolved. Their fever, they need to be feeling totally better, at the end of that time period. After that, they are no longer infectious. They do not spread COVID anymore, and you can absolutely be around them. There is no need to get another test. And this is something we still see people thinking, I tested positive, 10 days ago, 2 weeks ago, I want to get a negative test, or my work wants a negative test. No, if you get a PCR test like that soon after, it will still be positive because it's picking up dead virus. You are not still infectious, and you should not, once you've had a positive COVID test, you literally never need to get a COVID test again, unless it's, months later and there's new symptoms. So, back to this question, once they have been isolated, for that full time, it is safe to be with them. I would ask people, though, keep doing your masking and your social distancing. It's just good practice. You don't want to start thinking who's been exposed and who isn't, but that person would not be considered infectious. Okay. So we got through a decent amount today, I think. There will certainly be a lot more to talk about on Thursday. I believe Sybil Madison is with us, and we will talk quite a lot about the vaccine trial data. That's the big day that the FDA will be looking at this. And if you're interested, they are live streaming the actual meeting. So if you want to see the FDA debating this and the experts on the panel, you can tune in, and it's all available on the FDA website. Some good news, DCASE, the Department of Cultural Affairs and Special Events, has posted the Millennium Park at Home Chicago Holidays program. So it's nice, it's 30 minutes long. We are all having different traditions this year, and I'd encourage you to, get together with people who you live with. There's holiday greetings from the mayor, there's acknowledgments of Hanukkah and Kwanzaa and Christmas, there's the Chicago Children's Choir, Sones de Mexico Ensemble, some anniversaries and other folks. It's a nice thing, Chicago thing to do, 30 minutes to celebrate the holidays at home. Reminder, we're almost coming up to the end of the hashtag Takeout Chicago Challenge. If you dine at 10, if you get takeout rather at 10 bars or restaurants between mid-November and December 15th, you enter at chicago.gov/takeout, and you can win cool things like behind-the-scene tours at Soldier Field. And then finally, our new COVID-19 vaccine website, like I said, is live. So it's off the coronavirus website. It's also at chicago.gov/COVIDVAX, COVID-VAX. We're going to keep posting information there. So give us feedback. Let us know what other questions you're having. It's going to be a busy time, but a really exciting time as we're getting started in this next phase of the COVID response. There will be a press conference tomorrow at, I believe, 1:30. It's in the early afternoon in any case, about vaccine update with the mayor, with some special guests. So if you want to hear more about vaccine, tune in tomorrow afternoon, and the details will be posted on the mayor's Facebook page. Thank you very much. Keep doing the things that you know work, and send in your questions. We'll get to a lot more of them on Thursday. Be safe, Chicago.